In clinical medicine, we check electrolytes and nutrient levels every single day. Magnesium, potassium, sodium, calcium, B12, folate, vitamin D, because when these levels go wrong, people become seriously unwell very quickly. What most people do not realize is this. By the time someone is admitted to hospital with an unstable heart rhythm, severe confusion, or muscles that have stopped functioning properly, those deficiencies have typically been developing quietly for months, sometimes years. What I see as an acute crisis in the hospital is usually the endpoint of a process that was building slowly and silently for a long time. Today, I want to walk you through 15 nutrient and electrolyte deficiencies, organized as a ladder from common and quality of life impairing up to the rare ones that can genuinely threaten your life. And I want to make one critical point at the outset. Several of these deficiencies are made worse, not better, by attempting to treat them yourself without testing. Both too much and too little of certain nutrients can cause serious harm. I will flag each one where this matters. My name is Dr. Victor Hayes. Let's begin at the bottom of the ladder. The most widespread deficiency in the modern world is vitamin D, and the vast majority of people who have it have no idea. Your body requires ultraviolet light hitting your skin to produce vitamin D, but modern life has systematically eliminated that exposure. Most people work under artificial light. They drive enclosed vehicles. They apply sunscreen. They live in countries where the sun angle is insufficient for large portions of the year. The result, vitamin D levels quietly decline, and you begin feeling it in ways that seem completely unrelated to each other. Persistent fatigue that sleep doesn't fix. Muscle aches without a clear cause, getting every circulating virus. A mood that never quite lifts. Because vitamin D affects immune function, muscle tissue, bone health, and mood regulation simultaneously, the symptoms are so nonspecific that they rarely get connected to a single cause. Standard blood tests often don't check vitamin D unless bone problems have developed or you specifically request it. This means people suffer years of low-grade symptoms without understanding why. Ask your doctor to check your vitamin D level. If you are deficient, supplementing is safe, well-studied, and typically very effective. Deficiency number 2, magnesium, perhaps the most underappreciated nutrient in the body. Magnesium is involved in over 300 enzymatic reactions. When your levels fall, your muscles struggle to relax after contracting. The classic sign is night cramps, calves seizing up unexpectedly, or the eyelid twitches that won't stop. Beyond muscle cramping, low magnesium affects your nervous system, producing unexplained anxiety, palpitations that feel like your heart is racing or skipping, and sleep that never feels deep or restorative. Here is the testing problem. Most of your body's magnesium lives inside cells, not in your bloodstream. Serum magnesium, the standard blood test, is the last thing to fall. By the time it shows as low on a blood panel, you have been significantly depleted for some time. Magnesium is depleted by ultra-processed diets, by chronic stress, by alcohol, and by certain medications, particularly proton pump inhibitors used for acid reflux. The slow drain produces that characteristic wired and tired feeling that many people never manage to explain. One important caution: people with advanced kidney disease must be careful with magnesium supplementation, as impaired kidneys cannot clear excess magnesium appropriately. Deficiency number 3, iron. Very common, very easy to miss, and critically important to test before supplementing. Iron is the core component of hemoglobin, which carries oxygen through your bloodstream. When iron falls, your tissues don't receive adequate oxygen. You feel a specific, unrelenting exhaustion that rest doesn't fix. Climbing stairs leaves you breathless. Your concentration disappears. Hair may begin falling out or thinning. Some people develop restless legs, an irresistible urge to move their legs at night that destroys sleep. The testing nuance is important. Many doctors only check hemoglobin, which tells you whether you are clinically anemic. But by that point, you have already exhausted your iron stores. The test that catches iron deficiency earlier is ferritin, which measures stored iron. Ferritin often gets overlooked. Why does testing matter so much? Because iron overload is toxic. It damages the liver, heart, and pancreas. Some people carry a genetic condition that causes them to absorb too much iron, and supplementing in that context causes serious harm. This is absolutely a test first, supplement second situation. Never supplement iron without a confirmed deficiency. Deficiency number 4, vitamin B12. And this is where deficiencies begin affecting your nervous system in ways that can become permanent if caught too late. B12 is essential for producing myelin, the protective coating that surrounds nerve fibers and allows electrical signals to travel properly. When B12 falls, that coating begins to break down. The resulting symptoms are recognizable and concerning. Pins and needles in the hands and feet that spread and worsen over time, unstable balance, foggy thinking that progresses to memory problems resembling early Alzheimer's disease. The frightening aspect, if this continues long enough, the nerve damage becomes irreversible. You can replace the B12. The nerves do not always fully recover. Who is most at risk? People following strict plant-based diets because B12 is only found in animal products, no plant food provides it. Supplementation for this group is not optional. Older adults, because stomach acid production declines with age, and B12 requires acid for absorption. People taking metformin, the most commonly prescribed diabetes medication, which gradually depletes B12 over years of use. Most people are never told about this, and it is rarely monitored. A testing nuance. Serum B12 can appear normal while active deficiency exists, because it measures total B12 rather than the biologically active forms. Treatment is sometimes initiated on clinical grounds without waiting for tests to become definitively abnormal. Deficiency number 5, folate, vitamin B9, which works alongside B12 in several critical processes. Your body needs folate to produce DNA and form red blood cells properly. Deficiency causes anemia, persistent fatigue, mouth ulcers that keep returning, and impaired immune function. Folate deficiency is most common in people who do not eat enough leafy green vegetables. In people who drink heavily, alcohol significantly impairs folate absorption and utilization, and in people with conditions affecting nutrient absorption like celiac disease or Crohn's. A critical warning: never supplement folate without first checking B12 levels. Folate can mask a B12 deficiency on blood tests while nerve damage continues silently underneath. If both are low, B12 must be treated first or simultaneously to protect your nervous system. This is why doctors always test both together. Deficiency number 6, iodine, which controls your entire metabolic rate through the thyroid gland. Iodine is the raw material your thyroid uses to produce thyroid hormones. These hormones set the speed at which your body runs. When iodine is deficient, the thyroid cannot produce enough hormone. Your metabolism slows. You feel cold and fatigued. Weight increases without any change in eating. Hair becomes thin and brittle. Thinking slows. In severe long-term deficiency, the thyroid gland swells as it tries desperately to capture more iodine, forming a visible lump in the neck called a goiter. Iodine was a significant public health problem until salt iodization was introduced. But iodine deficiency is creeping back as people switch to Himalayan or sea salt, which sounds healthier but contains almost no iodine, and as dairy consumption declines, removing another major dietary source. Critical caution: iodine is not safe to supplement freely. Too much can trigger or worsen thyroid disease, particularly in people with underlying autoimmune thyroid conditions. This sits in an uncomfortable middle ground where deficiency is harmful and excess is also harmful. Testing before supplementing is essential. Deficiency number 7, zinc, essential for immune function, wound healing, and reproductive health. When zinc falls, the immune system cannot produce or activate immune cells effectively. You get sick constantly and recover slowly. Wounds heal sluggishly. Loss of taste and smell, which sounds minor but significantly impairs appetite and quality of life. Hair loss beyond normal shedding. In men, reproductive function is affected because zinc is required for testosterone production. People eating plant-heavy diets are at higher risk because zinc in plant foods is less bioavailable than in animal products. People with chronic inflammatory bowel conditions are also at elevated risk. Here is the important caution. Long-term high-dose zinc supplementation causes copper deficiency because zinc and copper compete for absorption. Copper deficiency causes its own serious problems, including anemia and nerve damage that closely mimics B12 deficiency. Food sources of zinc are safer than high-dose supplements taken indefinitely. If you supplement, use modest doses and for defined periods. At this point, we move from deficiencies that impair your quality of life to deficiencies that can directly destabilize your heart rhythm, cause seizures, and in extreme cases, be fatal. Several of these are made significantly worse by attempting to treat them yourself without medical guidance. Please pay close attention to the cautions I give for each. Deficiency number 8, potassium. And this is the first on this list that you should never attempt to treat yourself. Potassium is the primary electrolyte inside your cells. It is essential for muscle function, including heart muscle. When potassium falls too low, muscles become weak. But the life-threatening risk is cardiac. Low potassium makes your heart rhythm electrically unstable, increasing the risk of arrhythmias that can stop your heart. Potassium depletion happens when you are losing fluids faster than replacing them, vomiting, diarrhea, diuretic medications, or in eating disorders involving purging. Why is self-supplementation dangerous? Because high potassium, hyperkalemia, is equally dangerous and can cause sudden cardiac arrest with almost no warning. Your kidneys normally regulate potassium tightly, but if kidney function is reduced, or if you take certain medications, potassium can climb rapidly with supplementation. Both ends of the potassium spectrum can kill you. Testing and medical supervision are non-negotiable. Deficiency number 9, calcium. Calcium is essential for bone integrity, muscle contraction, nerve signaling, and blood clotting. When levels drop acutely, you get muscle spasms, tingling in the mouth and fingers, and in severe cases, seizures and cardiac arrhythmias. Here is the clinical reality. Calcium deficiency is rarely a dietary problem in isolation. When calcium is genuinely low on blood tests, the question is not, should I take more calcium? The question is, why is my body not maintaining normal calcium levels? Usually the answer is vitamin D deficiency, because you need vitamin D to absorb calcium. Sometimes it is a parathyroid gland problem. Sometimes it is related to kidney disease or medications. Blind supplementation has become controversial. There is evidence that high-dose calcium supplements may increase cardiovascular risk in some people. Most people get sufficient calcium through diet. If blood calcium is genuinely low, investigate the cause rather than simply supplementing. Deficiency number 10, thiamine, vitamin B1, which is genuinely missed routinely and can cause severe, life-threatening complications. Thiamine is essential for energy production in every cell, but especially in high-demand organs like the brain and heart. Severe thiamine deficiency causes two distinct serious conditions. The first, Wernicke's encephalopathy, involves the brain malfunctioning, confusion, memory loss, abnormal eye movements, and loss of balance. The second, wet beriberi, involves the heart failing with severe fluid accumulation throughout the body. Both conditions can be fatal without prompt treatment. Both respond remarkably well to thiamine replacement when caught in time. Who is most at risk? People with alcohol use disorders. Alcohol blocks thiamine absorption and accelerates its breakdown simultaneously. People after bariatric surgery, anyone who is severely malnourished. The frustration, thiamine deficiency is rarely tested routinely, and by the time symptoms appear, the situation is already serious. High clinical suspicion in at-risk patients and early thiamine replacement can be life-saving. Deficiency number 11, sodium. We hear constantly about reducing sodium for blood pressure, and that advice is generally appropriate for most Western diets. But sodium can become dangerously low, and this is underappreciated. Low sodium, hyponatremia, causes dizziness, headaches, nausea, and confusion. In severe cases, it causes seizures and brain swelling. Who is at risk? People who restrict salt very aggressively, people who drink excessive amounts of water, and critically, people taking certain medications, including some antidepressants, which affect how the kidneys handle sodium. The most dangerous aspect of sodium correction. If you correct low sodium too rapidly, you can cause a devastating condition called osmotic demyelination syndrome, where rapid sodium shifts permanently damage the protective coating around brain nerve fibers. Sodium correction must be done slowly, carefully, and under medical supervision, often in a hospital. This is not something to self-treat. Let me briefly cover the final four, which are uncommon but critical to understand. Copper deficiency typically occurs from excessive zinc supplementation or after bariatric surgery. It causes anemia, nerve damage, and balance problems that can mimic multiple sclerosis or B12 deficiency. It requires specialist management. Selenium deficiency in selenium-depleted regions can cause a specific form of heart muscle disease. The danger is that selenium sits in a narrow, safe window. Deficiency is harmful, and toxicity happens more easily than with most nutrients. Hair loss, nail changes, and nerve damage are signs of excess. Do not supplement selenium freely without testing. Phosphate, low phosphate is encountered clinically in the context of refeeding syndrome, when someone severely malnourished begins eating again too rapidly. The resulting phosphate shifts can cause respiratory muscle weakness, heart rhythm disturbances, and altered consciousness. This is a hospital-level emergency requiring careful monitoring. Vitamin A deficiency is rare in developed countries, but vitamin A toxicity, because it is fat-soluble and accumulates, causes liver damage, bone problems, and in pregnancy, severe birth defects. Supplementing beyond a standard multivitamin requires medical guidance. Let me close with the pattern that connects all 15. Symptoms appear long before blood tests flag anything as abnormal. Normal on a lab result does not mean optimal. Standard tests are designed to catch late-stage disease, not early depletion. More is not better. For multiple nutrients on this list, deficiency and excess are both dangerous. Guessing, supplementing based on what seems popular or what you have read online, is how serious problems develop. If you are experiencing persistent symptoms that remain unexplained, fatigue that doesn't improve, brain fog, unexplained anxiety, poor sleep, recurring illness, push for comprehensive testing. At minimum, ferritin, vitamin D, B12, folate, magnesium, and thyroid function. If you are in a high-risk group for any specific deficiency due to diet, medications, medical history, or lifestyle, do not wait for symptoms to become severe. Catch and correct deficiencies while the intervention is simple before they progress to clinical complications. And if you are considering supplementing anything beyond a standard multivitamin, particularly potassium, calcium, or iron, get tested first. The goal is not just avoiding deficiency, it is avoiding both ends of the spectrum with your specific situation properly understood. Your body gives you signals long before anything becomes a crisis. The fatigue, the cramps, the brain fog, the poor sleep, these are not just part of modern life. They are often your body telling you that something specific is missing. Learn the signals, get tested appropriately, and work with your doctor to address deficiencies properly, not guess. If this was useful, please share it with someone who would benefit. Subscribe to this channel for more evidence-based content, and leave a comment telling me which nutrient you found most surprising. I'll see you in the next video.